Hello, my name is Dr. Paula Tucker, and I am the co-director of the Emergency Nurse Practitioner program here at Emory University. I would like to briefly share with you a little bit about myself. I am a proud graduate of Emory's EMP program, and I've been with the School of Nursing since 2015. I currently practice in the emergency department at Emory University Hospital, as well as Grady Memorial Hospital. I even do a little bit of research on the side, and my research interests involve quality improvement and implementation science. Before I share with you about Emory's DMP EMP program, I feel that it is important to provide an understanding of emergency care and the role of the emergency nurse practitioner. Emergency care is not defined as a setting, but rather as a practice delivered in diverse settings, including but not limited to emergency departments, urgent care clinics, emergency department clinical decision units or observation units, emergency medical response vehicles, telehealth, disaster locations, correctional facilities, and even some occupational health centers. Emergency care is a unique specialty practice encompassing the evaluation, management, and treatment of patients who experience an unexpected illness or injury of varying complexity. 68% of patients across the lifespan who present to the ED have primary care problems. Therefore, the foundational academic preparation as a family nurse practitioner prepared to care for patients of all ages with additional training in the management of patients with life-threatening and urgent conditions is the most appropriate preparation for practice within emergency care settings. Now, you may ask, what about the acute care nurse practitioner and the Association of Emergency Care? There are acute care nurse practitioners who do practice in emergency care settings. However, these nurse practitioners have a limited scope of practice based on patient age. Therefore, acute care nurse practitioners are not prepared to work across most other emergency care settings. Similarly, family nurse practitioners are not prepared to work across emergency care settings because they do not train in acute resuscitation and stabilization of patients with life-threatening conditions. Emergency nurse practitioners are prepared to provide care to patients of all ages, ranging from acute resuscitation and stabilization of life-threatening health problems to management of minor injuries and illnesses. The role of the emergency nurse practitioner consists of medical screening, decision-making, and patient management, including specific emergent and urgent care procedures such as 12-lead EKG and radiology interpretation, wound management, foreign body removal, basic ortho procedures such as splinting, reductions and arthrocentesis, and resuscitative procedures, including chest thoracostomy, central vascular access, and airway management. I would like to now highlight specific emergency care settings in which an emergency nurse practitioner is prepared to practice. EMPs provide rapid evaluation and initiation of care in emergency department treatment settings and also pre-hospital settings. Here is our EMP director, Dr. Diane Evans, precepting one of our Emory EMP alums at Emory University Hospital Emergency Department in triage. This alum now owns her own urgent care practice. Emergency nurse practitioners are also prepared to work in emergency department fast track zones and urgent care clinics. Here are two of our Emory EMP alums working in an urgent care center in Portland, Oregon. Mobile integrated healthcare teams represent an emerging innovative care model where emergency nurse practitioners provide urgent care in a patient's home supported by a paramedic. These teams provide care for lower acuity problems, including wound repair, administering IV fluids and medication management, and even reducing unnecessary ED visits. This model of care is increasing because it's cost-effective and it improves patient satisfaction. All of our EMP students complete clinical hours training in mobile integrated healthcare teams. Another emerging care model is the utilization of telehealth to facilitate emergency care across diverse settings such as emergency departments, clinical decision and observation units, and delivering emergency care in rural and critical access settings. Now, one of the first clinical rotations our students complete is working with nurse practitioners in emergency department observation units. This is an opportunity for our students to better understand and provide care to emergency department patients who are admitted for time-limited workups by providing protocol-driven, cost-effective care by reducing hospital admissions, emergency department readmissions, and improving overall patient outcomes. While emergency nurse practitioners may work autonomously, providing care to patients who present with lower acuity problems, emergency nurse practitioners are also prepared to manage patients who require higher levels of care. I want to emphasize, however, that working in higher acuity and trauma areas within the emergency department is not an autonomous role, but rather is team-based care led by an emergency department physician. One of the highlights of our emergency nurse practitioner program is the opportunity to obtain 180 to 200 clinical hours at Grady Memorial Hospital's Level 1 Trauma Center, working alongside emergency medicine residents and advanced practice providers. Disaster preparedness and response is also a component of emergency care, and emergency nurse practitioners are required to be on the front lines when disasters occur. A required disaster preparedness and response course has been integrated within our program to prepare our students for such a role. As healthcare is shifting and patient populations are aging, access to emergency care is often limited in rural communities. Therefore, we prepare our EMP students to care for older adults and to work in rural emergency departments where workforce gaps currently exist and where knowledge of how to use telehealth and work within mobile integrated healthcare teams is essential. Now that I have provided an overview of the EMP role, I am excited to share with you about our DNP-EMP program here at Emory. Emory established the EMP program in December 2002 through funding by the Bureau of Health Professions, Health Resources and Services Administration. It's through this funding, the EMP program successfully joined with the Emory School of Medicine, Department of Emergency Medicine, to create an interdisciplinary academic partnership to specifically train EMP students with emergency physicians. Since this establishment, 203 students have graduated from our program and are currently working as nurse practitioners throughout the country in a variety of emergency care settings. I want to highlight a key component of our EMP program that sets us apart from other EMP programs across the country. As a result of our partnership with the Emory School of Medicine, Department of Emergency Medicine, our curriculum and training is based on an interdisciplinary model where our students train with emergency medicine residents to build competency in team-based care. We believe this clinical training model is crucial to the role and significance of the emergency nurse practitioner. There are prerequisites for admission into the EMP program. Emergency care experience is required since it is critical to understand the triage process and how the emergency department team optimizes patient care. One of the cornerstones of the EMP role is to understand the value of teams in providing life-sustaining and urgent care to patients. Emergency care is a unique practice, and we seek individuals who have experience and display a passion for emergency care. We require 2 years of EDRN experience or related work experience, such as military or paramedic. If you do not have any emergency care experience, we highly recommend you enroll in the School of Nursing MN track, obtain your RN degree, then following graduation, enroll in a 2-year emergency nursing residency program, preferably at a level 1 trauma center. And we believe this will provide you with the necessary experience to be a successful EMP student. In addition to the prerequisites for admission into Emory's DNP-EMP program, our curriculum focuses on preparing EMP students as clinical experts and leaders through a 7-semester integrated doctorate of nursing practice degree. So you might ask, why is a DNP necessary? As healthcare is constantly changing and emergency care is evolving, the role and practice of the emergency nurse practitioner is critical in leading and translating safe, evidence-based, high quality care within the microsystem of emergency care. And we believe the Doctor of Nursing practice education provides these skills within this ever-changing complex healthcare system. Now, in addition to the required DNP project and program hours, the DNP EMP student will be required to complete a total of 840 direct clinical hours, which include 500 direct F&P hours and 300 ED hours. The DNP EMP student will begin their clinical rotations within the second semester of the program. Our clinical rotations include, but are not limited to, urgent care, radiology, Grady Emergency Care Center, which is our level 1 trauma center in Atlanta, Georgia, other Emory-affiliated academic community emergency departments, observational units, pediatric emergency departments, and experiences with the Grady Healthcare Emergency Medical Response and Mobile Integrated Health Units. The DNP EMP program is extremely rigorous and it does not have a part-time option. Therefore, we do not recommend that you work full-time while enrolled in the program. For more information about the EMP role, please refer to our professional organizations, the American Academy of Emergency Nurse Practitioners, the American Association of Nurse Practitioners, and the Emergency Nurses Association. Once you are admitted, you can join these organizations through student memberships at a reduced cost. Well, that concludes the overview of the DNP EMP program. Thank you for your interest, and please don't hesitate to reach out to us if you have any further questions. Enjoy the rest of your open house.